Pregnancy is very delicate, so during pregnancy, we make sure we take very good care of ourselves. If you're pregnant or you're about to get pregnant, join me and let's talk about the danger signs of pregnancy. Hi lovies, welcome or welcome back to my channel. Today, if you're new here, kindly subscribe, like, comment and share to others to also learn the dangers signs that or anytime we see, we need to report as soon as possible to the hospital or to our midwife. I go by the name Nurse Kote. The first danger signs I would like to talk about is headache. With headache as a pregnant woman, you don't need to do self-medication. It might be that you have an underlying cause like BP or different thing. Taking your headache as a normal thing and taking any medication is a no-no. Severe headache is a danger sign in pregnancy. The moment you feel that you are having headache, kindly contact your midwife or go to the hospital for prescription or a prescribed medication. The second thing I'm going to talk about is swollen feet, face and arm. Most of the times when we see pregnant women with swollen feet and face, that's why I put it. No, on the eye put it. It is a danger sign in pregnancy. With this, it can lead to more complications or it shows an underlying cause which needs to be tackled. So I will advise you that you see your midwife for immediate intervention. The next thing we are going to talk about convulsion or fit. If you fit or convulse as a pregnant woman, it is a danger sign. Kindly visit the hospital as soon as possible, or if your wife or your sister in one way or the other fit, kindly rush the pregnant woman to the hospital. The next thing we are going to talk about is seeing water, like your water bag gets burst and starts flowing before labor. Probably you are in your third month, probably you are in your 6th month or 7th month and you see your bag of water breaks as a pregnant woman. Kindly go to the hospital because you might not know the causes or you feel a leak of it. Please, it's not a good sign. Kindly visit the hospital or call your midwife because you have your midwife's number in your ANC booklet. The second page, you'll find the number there. The next thing we talk about is feeling dizziness. Please, it's also not a good sign. It might have underlying cause. Kindly contact your midwife or go to the hospital for checkup. The next thing is having high temperature. Please don't take any medication. Avoid self-medication during pregnancy. Visit your midwife or hospital or see the doctor for proper treatment. Having excessive increase of child movement or the feeling decrease of child movement. The increase is a problem and the decrease is a problem. At least you know how the baby moves. But when you move, that one is different. We have persistent increased child movement or persistent decreased child movement. With that case, you have to see the doctor. It can be there's a problem. When there is a problem, they will solve it for you. They will tell you the necessary things you are supposed to do. 2 days, 3 days. It might lead to something you are not expecting to hear. The next thing we are going to talk about is having a greenish fluid flowing down. Seeing this, a smelly and a greenish fluid can be it is a dangerous sign to see in pregnancy. So with this, when you see it, kindly visit the hospital for better management. Persistent vomiting. Some people vomit a lot in their first trimester and at least once a while is okay, but not if it is persistent, kindly visit the hospital, because the more you vomit, you are losing fluids. When you visit the hospital, interventions will be done for you to stop vomiting. If it is once a while, cool, but if it is persistent, kindly visit the hospital and you will be sorted out. Having abdominal pains is quite normal in pregnancy, because one way or the other you feel pain here and there, but having severe, the underlying word is severe abdominal pains is a danger sign. So kindly visit the hospital or call your midwife anytime you feel severe abdominal pains, because if you don't report, you might get an abortion or miscarriage or something extra. So kindly visit as soon as possible to the hospital for checkup. The next thing we are going to talk about is bleeding. You are in your first month, second month, third month, and you are still bleeding. Fourth month, fifth month, sixth month, any of the month you bleed, please. Bleeding in pregnancy is a danger sign, especially if you really need a child, if you want this precious. The moment you see bleeding, rush to the hospital. Any of the signs we talked about needs urgent attention. So, as a pregnant woman, your favorite nurse is here, and we are talking about our danger signs. And we said, any moment you see this signs mentioned, kindly rush to the clinic or call your midwife for proper management. Thank you for watching this video. If you find this video interesting, kindly subscribe, like, comment, and share to others. I still go by the name Nescote. See you in my next video, and bye.